Back everyone, gallbladder issues are a pretty big problem in our country. Millions of Americans are seeking treatment every year.
Dr. David Young with East Texas Vascular Associates joins us today to talk more about it. Nice to have you here, by the way. We were talking earlier, Doctor. Give us, first of all, what is a gallbladder? What does it do in the body?
The gallbladder is a small sac-like organ that lives underneath the liver, and it serves to store and concentrate bile, and it serves to help us digest our fats properly. And the gallbladder can become diseased, it can develop stones, it can become inflamed and precipitate problems from there.
How can we tell that we have problems in our gallbladder? Can we feel it?
The most common problems that people encounter with their gallbladder are nausea and abdominal pain. And normally the abdominal pain is situated underneath the ribs on the right side or right underneath the breastbone, and it can radiate through to your back between the shoulder blades. And this is frequently encountered after people eat, especially a fatty meal, fried foods, high fat content items. And the pain can be associated with nausea, or someone could just simply present with nausea.
How do the gallstones take place? I hear about having a gallstones removed. What is that? What causes that?
The gallstones, 80% of gallstones are cholesterol stones, and this occurs because of an imbalance that occurs within the environment in the gallbladder, and the gallbladder simply causes these cholesterol crystals to form and then ultimately form, kind of condensate, if you will, and form a stone.
Will you take us through some of the options if we do have some issues with our gallbladder, what we can do to get healthy?
That's an excellent question. Treatment for gallbladder disease is removal of the gallbladder. There are no medicines that we can give you to help make the gallstones go away that are lasting. So ultimately, the treatment of gallbladder disease is removal of the gallbladder.
And we can live just fine without it. Is that right?
You certainly can. When people have gallbladder disease and the gallbladder is removed, then they'll notice that they can now eat. They're no longer having the pain. They're no longer having the nausea, and an improvement in the quality of life.
Can you still eat the good old fatty foods that
You sure can.
No kidding.
Wow.
Oh, that's the most important thing. I want to make sure I can do that.
Modern medicine is really amazing. I was just intrigued by the Da Vinci robot surgery. Will you tell us about that?
Yes, it's exciting. In the mid-'80s, laparoscopic surgery came to the forefront, and that has been the standard of care for removal of the gallbladder until most recently we've had the development of applications in general surgery for the removal of the gallbladder. And the way this is done is we make a one inch incision at the belly button, and the nice thing about the robot is it has the precision to place all of our instruments through this tiny 1 inch incision.
My goodness.
And the camera is a 3-dimensional high definition camera, so we actually have depth within the operative field, and it adds for precision in terms of being able to get in there and remove the gallbladder with precision. And it's an exciting technology. Patients love it. There's one incision instead of 4 incisions. There's less pain, there's less scar, and the patients are very pleased with the procedure.
And obviously, when anytime you guys talk about invasive surgeries, I mean, the recovery time is a heck of a lot faster.
That's exactly right. Yeah, the patients have less pain. They get back to their activities of daily living, the things that they enjoy doing more rapidly.
You've been doing this a while. I won't say how old, but you've been doing this a while in your surgery. Do you ever wake up and go, is there ever a point you just do a Gomer Pyle and go, golly? I mean, it's amazing how far surgery has come in just a few years.
It really is. And this is an exciting time to practice medicine with the advent of the new technologies that we can now apply to common problems that we all have. And so it's a very exciting time to be involved with surgery.
And of course, the first step is to check with our doctor and to figure out how can we contact you.
Well, myself and two of my partners perform this procedure, Dr. Blake Harrison, Dr. Tyrone Miller, and myself, and we can be reached at East Texas Vascular Associates, and our phone number is 903-595-2636.
Doctor, nice to have you here.
Thank you so much for having me.
Enlightening us a little bit. We appreciate that. We'll see